I will now be performing the functional portion of the assessment, performing hand hygiene and placing on gloves. I will first assess the patient's appearance. Patient's height and weight is appropriate and within normal limits in relation to patient's health, lifestyle, and age. Patient demonstrates appropriate mood and behavior. Patient is relaxed. Patient's posture is erect. And patient demonstrates appropriate grooming. I will now assess the patient's skin by palpating with my fingers and placing the back of my hand on the patient's forehead. Skin appears warm, smooth, dry, and intact. Skin is free of any lesions or abnormalities. Skin is even in pigmentation. I will assess the patient's skin turgor by pinching a portion of the forearm with in between my fingers. Skin turgor is normal and within normal limits. I will assess the patient's mucous membranes, removing any dentures if applicable. Patient's mucous membranes appear pink, moist, and soft, free of any lesions or abnormalities. I will now assess the patient's hair and scalp. Patient's hair is red to brown in color. It is smooth in texture, free of any parasites or lesions. It is even in amount and distribution. And like I said, free of any parasites or lesions or abnormalities. I will now assess the patient's nails. Patient's nails are pink, normal in size, shape, and free of any lesions or abnormalities. I will now assess the patient's neurological system, assessing the patient's pupils. Patient's pupils are round, reactive, equal, and accommodating. I will now assess the patient's gait, asking the patient to stand and walk heel to toe. And you can sit. Patient's gait appears to be within normal limits and is balanced bilaterally. Patient's posture is erect. I will now assess the patient's musculoskeletal system by asking the patient to place both arms above the head and back down. Also at the same time assessing the patient's muscle tone, and then asking the patient to raise the arms bending at the elbow, going up and then back down, and then asking the patient to turn both hands inward at the forearm and then outward and placing back down. Patient's muscle tone and range of motion both are within normal limits. Patient's posture is erect and gait was assessed within the neurological portion of the assessment. I will now assess the patient's cardiovascular system, patient's heart rate, rhythm, cardiac cycles S1 and 2, central and peripheral pulses and temperature were assessed during the vital signs portion of the physical assessment. I will now palpate the patient's shin, assessing for any edema. No edema is noted. I will assess the patient's capillary refill. Capillary refill is less than 3. No cardiovascular abnormalities noted. I will then move on to assessing the patient's respiratory system. The patient's respiratory rate, depth, rhythm, and effort were assessed in the vital signs portion of the physical assessment, and I will now auscultate the patient's lung sounds. Patient's lung sounds are clear and equal bilaterally. No cough is present. Patient's chest expansion is symmetrical. I will assess the patient's nasal patency by asking the patient to occlude one nostril with the finger and blowing outward, and doing the same on the other side. Patient's nasal passages are clear. Patient's sputum is clear and within normal limits of amount. No abnormalities are noted. I will then assess the patient's gastrointestinal system. While the patient is sitting in the upright position, I will assess the abdominal contour. Patient's abdomen is round and flat and within normal limits. I would assess for fecal frequency and consistency, assessing for any visible or occult blood. Fecal frequency and consistency are within normal limits. No visible or occult blood is present. Patient is free of nausea or vomiting. If an ostomy was present, I would assess this patient. No ostomy is present. I would then ask the patient to lie down and auscultate bowel sounds in all 4 quadrants. Valve sounds present in all 4 quadrants and within normal limits. No abnormalities are noted. I would then move on to assessing the patient's genitourinary system. I would assess the patient's urine for color, consistency, character, odor, and amount. I would assess for ostomy if present. No ostomy is for this patient. I would assess the external genitalia, and I would assess the anus for appearance and patency. I would then move on to assessing the reproductive system of the patient. If the patient is female, I would then at this time perform a breast exam, palpating with my fingers in a circular motion, moving from an inward to outward, palpating all the way up into the axillary area, noting for any nodules, lumps, pain, tenderness, and documenting any abnormalities. If the patient was a male, I would perform a testicular exam, cupping each testicle in the palm of the hand and palpating the testicle with between the thumb and index finger, notating for any nodules, lumps, pain, tenderness, change in consistency, color, shape, size, and documenting any abnormalities. And this would complete the functional portion of the assessment. I would immediately document any abnormal findings to the charge nurse, removing gloves and performing hand hygiene.